supporting your workforce by showing up to cancer and facilitating an active workplace. Why is this topic important? Cancer incidence is increasing. According to Cancer Research UK, every 2 minutes someone in the UK is diagnosed with cancer. It is important to recognise that for some, the diagnosis may mean a shortened life. Prevention and early detection are vital. Cancer treatment and the cancer itself can cause side effects that have an impact on people's physical health and quality of life, such as fatigue, eating or speech difficulties, or continence issues. These can also affect their mental health or their ability or desire to engage in social activities. Treatment stretching over a long period can also take time away from other important activities, such as work, childcare, or other caring responsibilities. Here in South Yorkshire and Bassetlaw, our cancer strategy focuses on a number of key areas: cancer prevention, earlier diagnosis, improving access to treatment, supporting people with the consequences of their cancer and its treatment, and also maximising quality of life. A number of measures are needed to address these goals. Encouraging and supporting people to live healthily is important, and as part of this, promoting the benefits of physical activity and enabling people to be physically active. The aims of this presentation are to provide an overview of the benefits of physical activity for people's health and in relation to cancer, to detail the physical activity guidelines for all adults, including those with cancer, to consider what is meant by an active workplace, to outline what this might mean in terms of supporting people with cancer to be physically active, to provide practical guidance on how this is achieved within a workplace. Cancer prevention and lowering people's risk of cancer. Evidence from the World Cancer Research Fund suggests that around 40% of cancer cases could be prevented if people followed a range of recommendations focused on living healthily, including a recommendation to be physically active. Convincing evidence has shown that exercising regularly helps to lower the risk of breast, colon, and endometrial cancers in particular. But the research is compelling for a range of cancer types. Notably, the World Cancer Research Fund also highlights the need for governments and other organisations to create environments that make it easier for people to follow their recommendations. Research shows that physical activity, in line with recommended guidelines, can reduce cancer recurrence and cancer deaths. To date, most research has demonstrated this for breast, colon, and prostate cancers in particular. As explained by Cancer Research UK, physical activity helps to reduce the risk of cancer returning by maintaining a healthy weight. This is important, as excess body fat is a known risk factor for many cancers. Physical activity helps to regulate hormone levels, such as insulin and estrogen, hormones that also encourage cells to divide more often and have been linked to an increased risk of breast cancer, for example. Taking part in physical activity regularly can also boost the immune system, enhancing its ability to deal with any damaged cells that may go on to cause cancer. It helps to reduce inflammation, which can irritate tissues and damage cells, increasing the chance of a cancer starting or spreading. Physical activity also reduces how long it takes for food to pass through your bowels, limiting the time the bowel lining is exposed to potential carcinogens, potentially reducing the risk of bowel cancer. Physical activity before, during, and after cancer and its treatment can improve quality of life in a number of ways. These include improving tiredness and increasing energy levels, improving sleep, enhancing mood, reducing stress, anxiety, and depression, improving memory, concentration, and cognitive function, improving heart health, lowering blood pressure, and improving cholesterol levels, strengthening muscle and bone, improving flexibility and balance, boosting the body's immune function, helping to maintain a healthy weight, and helping people to manage and lessen the severity of certain symptoms. Exercise doesn't always make cancer go away, but puts the patient back in control. We know People who exercise regularly experience fewer side effects: cancer-related fatigue, mental distress, lower risk of their cancer coming back or dying from the disease. Before receiving treatment, physical activity can help to improve someone's physical and mental health as they prepare to start their treatment. This can help them cope better with the demands of treatment and lessen the extent to which their health declines during this time, helping them recover afterwards. During treatment, balancing exercise and rest can help to minimise the decline in health and manage certain side effects. Cancer treatment will still have an impact on someone's physical and mental health, even if they've prepared for this beforehand. The burden of attending for multiple treatments, often over a long period of time, or going through a major surgery will affect a person's general health. Physical activity, or whatever the person can manage during this time, can help to minimise any deconditioning and can also help to manage certain side effects, such as fatigue, nausea, weakening muscle or bone strength, problems with concentration. This is known as brain fog. Continuing to be physically active after treatment will help people to rebuild their physical and mental health. It can also help people to minimise the severity of any lasting effects or those that develop over time. As part of someone's cancer treatment and care plan, they might be referred to a service that helps them to be physically active with the support of fitness professionals. If so, it's important that people are encouraged and supported to attend these, as much as any other appointment they might have related to their cancer. This might be referred to as prehabilitation before treatment or rehabilitation after treatment, and will also include advice on nutrition or other supportive measures such as psychological support. In Yorkshire, we have a scheme called Active Together, funded by Yorkshire Cancer Research. What do we mean by physical activity? Physical activity is movement that is carried out by skeletal muscle that requires energy. Basically, any movement is physical activity. Exercise is planned, structured, repetitive, and intentional movement intended to improve or maintain physical fitness. What is moderate and vigorous intensity will depend on a person's physical health. An activity is moderate intensity if you could talk during but not sing. An example might be household chores like mowing the lawn, or an activity like walking. For some people, this might be reached at a lower walking pace. For others, it would require a faster pace. During a vigorous activity, you could say a few words but not hold conversation. For example, this could be running or dancing, but again, for someone this might be a slower jog as opposed to a faster paced run. During cancer treatment, what was previously an activity that you found quite easy, such as walking the dog, might feel more like vigorous intensity, given the burden of treatment and how it makes you feel. Explore the Macmillan Physical Activity and Cancer resource, based on the American College of Sports Medicine guidance. This is a great starting point. Perhaps consider how easy it is for some to build those minutes of activity in throughout the week, especially if they are still spending a notable amount of time at work and in a particularly sedentary role. We even have guidance like this that outlines specific amounts of physical activity and types of activity for particular side effects or symptoms. Sedentary behaviour is any waking activity with a low energy expenditure. Typically, it's sitting or lying when awake with little movement, like screen time, watching TV, working from a desk or driving. The average sedentary time for a typical office worker can vary based on individual habits and workplace conditions. But research suggests that office workers tend to spend a significant amount of their workday sitting, often between 7 and 10 hours, more than the time they usually spend sleeping. Studies show that physically active employees are up to 12% more productive than their inactive colleagues. An active workplace is a work environment that encourages and supports employees to incorporate physical activity into their working day. An active workplace promotes movement-friendly policies, practices and culture to help reduce sedentary behaviour, improve employee health and well-being, and enhance overall workplace productivity and performance. Activity is a benefit to all employees as it can reduce risk of illness, reduce absenteeism and presenteeism, boost morale and improve workplace culture. Here are some examples of moderate physical activity to break up sedentary time at work. These are just options. Talk to your employee or employer about what could be facilitated. All of this is easier if others do it too. Talk to colleagues about ways physical activity can be normalised at work. There are different types of barriers to activity in the workplace. Physical barriers, such as fatigue, low energy, or a compromised immune system, could be tackled by short bouts of gentle exercise, breaking up sedentary periods, seeking support through colleagues, and online or home-based exercise guidance. There may be psychological barriers, such as fear of injury, reduced confidence, depression or anxiety. Aim to learn about how the benefits of activity can outweigh the risks and explore if any mental health support can be provided. Set small, achievable goals and celebrate success. Practical barriers, such as time, access to facilities and finances may be a barrier, but physical activity is free. Aim to break up long periods at work with short movement breaks, and remember that anything is better than nothing. Try adding reminders to the diary and do desk-friendly exercises. Explore whether there's any space at work that could be repurposed for employees to exercise. There may be social barriers, such as lack of support, stigma and judgment. Creating an environment that demonstrates an understanding of the consequences of cancer and its treatment, and the importance of being physically active and how this can be achieved at work. Top tips for people affected by cancer. Start small and listen to your body. No 2 days are the same, so it's important to take note of how you feel and adapt. Pace yourself. Fatigue is one of the most common symptoms during and after treatment, so gradually build up. Small chunks of activity split over the day can work well. Choose activities which bring you joy. Simple activities around the workplace can challenge your musculoskeletal system and bring strength-based benefits. Remember, anything is better than nothing. Just breaking up long-seated periods can be beneficial. Speak to your employer about building more activity into your workplace. This could boost productivity, increase social interaction and reduce sickness, as well as supporting you with your recovery and living well with and beyond cancer and its treatment.